Welcome, everyone. Saludos y bienvenidos a todos y todas. Today's Latinx Health webinar series is hosted by Tanoma Consulting. And before we begin, we would like to invite you to use the chat box throughout the session if you have any comments for the presenter or technical issues. We're going to leave about 5 to 10 minutes at the end of the session for Q&A. So you can use the Q&A chat box throughout the session as well. And please note that we are recording the session and we'll make it available to you. We're also thinking about ways that we can make it available to others not attending today, as well as our speakers. So today's session, Latinx and equitable food access during COVID-19, will focus on food access, equity, and resources. And we're joined today by Ms. Esther Sciammarella, Executive Director of the Chicago Hispanic Health Coalition. My name is Lisa Aponte-Soto, and I'm the founding president and CEO of Tanoma Consulting, the lead sponsor of this webinar series. So Tanoma Consulting is a national nonprofit consulting firm that provides culturally responsive research, evaluation, and training services to advance health, education, and workforce equity. Our mission is simple: to create innovative strategies that foster equitable practices for all communities. And for more information, you can visit us at www.tanomaconsulting.com. Our co-sponsor today is the Chicago Hispanic Health Coalition. The Chicago Hispanic Health Coalition's mission is to promote healthy behavior and prevent chronic disease in the Hispanic community. For more information about the Chicago Hispanic Health Coalition, you can visit www.chicagohispanichealthcoalition.org or call 312-842-2340. And without further ado, we are delighted and honored to introduce our guest, Ms. Esther Sciammarella, Executive Director and founding member of the coalition since its establishment in June of 1991. Esther holds a position with the University of Illinois Hospital and Health Systems, or UA Health, working closely with the medical director of the Pilsen Family Medicine Clinic on community health programming and training. She has extensive experience providing clinical therapy, mental health services, community support, and residential services for refugees and the mentally ill. She serves as CDPH Chair of Partnerships and Community Engagement for Healthy Chicago 2.0, and is also an investigative partner for the largest study of Latinos, SOY. Esther holds a Master's of Science in Clinical Psychology from the Illinois Institute of Technology. She graduated from the Harvard University John F. Kennedy School of Government's Hispanic Health Leadership Fellowship Program. And among her most notable accomplishments as a servant leader, she served on the White House Conference on Mental Health with Tipper Gore and collaborated with Dr. Jane Delgado on the book Salud, A Latina's Guide to Total Health, Body, Mind, and Spirit. She is also the former special assistant to the CDPH Commissioner for Hispanic Affairs, and these are just a few of her many, many accomplishments. You can find her full bio on the coalition's website or visit Tanoma Consulting on Facebook, Twitter, Instagram, and LinkedIn. We have posted her full bio there. It is my esteemed honor to welcome Esther today for our discussion. Welcome, Esther.
Thank you, Lisa. Thank you, because I'm looking at the mission of the coalition, who I think in certain way has been very important to thinking the importance of how we educate the consumer. More and more the coalition is thinking that we need to empower, for better words, I mean, the community related to health care issues. I was really concerned and waiting for any crisis when I was working with people in the clinic every day, particularly working with the chronic disease. I will say the majority of the clients and the community and the Hispanic communities in general, Latino, Latinx, is that people live longer, but at the same time with a lot of chronicity. And it's amazing and how much people want to learn. I think for many, many years, the coalition has been working and training community health workers. And we need to reach, and has been reaching, churches, schools, community, to educate consumers related to what they need to know. And it's, for me, the mantra is related to say, okay, you capitalist your body, how you take care of yourself. And I think it's sometimes, and this is the issue, is people are eager to learn. Even if we say from the mental health perspective, changing behavior takes time, I think we need to listen that how people need support. And I really enjoy learning and continue working with the consumer about what they need to know about take care of the how to take care of themselves. Yes,
it's so important that we have a model that consistently is inclusive of the perspectives of the individuals that we serve. So thank you. I really appreciate that. I'm sure a lot of our listeners and those joining us today agree with you. So to get us started in today's topic and conversation, Esther and I wanted to share a few key terms with all of you, because you're going to hear us mention these terms throughout the session. So we wanted to make sure that we are kind of leaning on the same language, or as we interpret these definitions. So first, in terms of food insecurity, according to the USDA, food insecurity is defined as inconsistent access to nutritionally adequate food and beverages because of limited financial and other resources. You may also hear us mention food deserts, and food deserts are neighborhoods with inadequate access to affordable and/or good quality whole foods, such as whole grains and fruits and vegetables.
Mm-hmm. Well, I think,
and then you're going to also hear us mention inequitable food access, or health equity as it pertains to food access. And we're referring to food insecurity as it is due to structural racism and systemic inequities that intersect with poverty, race, ethnicity, and gender, and contribute to unmet needs and hence poor health outcomes, including poor physical and mental health. And equitable access to food is more prevalent in communities of color, sadly so. Given that communities of color encounter significantly higher rates of chronic disease for conditions including diabetes, hypertension, heart disease, and obesity, among other conditions, cancer, inequitable food access may compound the outcomes of these health conditions. And so, since the onset of the pandemic, as a result of increased unemployment and reduced wages, we've seen an increased demand for food assistance. And here we see a map of the state of Illinois pre-COVID. And you can see the circled area is the community centered in the Chicagoland area, where Esther's work is mostly centered, and she's going to be talking about all of the great things that they're doing there. The darker shaded green areas in the map indicate higher rates of food insecurity. So you can see that there were significant Chicago neighborhoods with food insecure households. And we know that pre-COVID, 1 in 6 US households were food insecure, and that translated to 400,000 Chicago households being food insecure. So since the onset of COVID, we know that the number has doubled, tripled, depending on the community area, and it's affected the most vulnerable: children, elders, communities of color, households affected by unemployment, reduced wages, essential workers, and many others. So if you look at this next figure, you see that the impact has reached the middle class. And this is a figure indicating the rate of the middle class since 2001 to now post-COVID as of April 2020. And we see a spike in the rates of food insecure households, including those of mothers with young children. So Esther, as we just illustrated,
if you go back
in the COVID pandemic, we have seen a drastic increase in unemployment and reduced wages, which has exponentially increased the demand for food access. We know that communities of color are more likely to be food insecure. How has this impacted Latinos in the Chicagoland area?
Okay, so Lisa, if you go back to the map of the food. If you go back to the map, I wanted to touch certain things. I know that the majority of people who are in before the previous one, and I think many of you who are here, between us or people who are already in the field of public health, is nothing new what is going on. The surprise is that suddenly we are in the COVID-19 pandemic. But what happened in our communities endemic is not new. And we know that anytime that something occurred in our communities, in the communities of color, for all insecurities they are particular, and I wanted to emphasize in food. When Lisa, the previous one, when you talk about food deserts, and see, I want to emphasize food insecurity. Everybody knows. If the consumer know what is nutritionally adequate food, we find out, and this is my big concern, that people are getting food in the different pantries and shelters, and in reality, I don't know if they are really connected with the healthcare system. I have been seeing a revolving door related to chronic disease and nutrition, and how people giving food without not knowing the health condition of people. So it's a revolving door. People going for treatment, but at the same time, they don't know what means nutritional food. So that is one of the issues that I see, that when people come with tremendous high level of hemoglobin A1, they don't know what they need to do about food is medicine. And I need to repeat this because we can prevent a lot of elements of chronic disease, or at least decreasing, and I have been seeing that when people eat less, we can put the example of carbohydrate, and people are decreasing the hemoglobin A1. So prevention means, what is meaning to the consumer know what they need to be done by the nutritional things. How is why we need to work in, we has been working in the coalition, the cheaper food and food who is not suitable for our community. So one of the things that we need to deal in the community, Chicago or any city in the country, is how we work block to block, community, and different communities have different needs and different things. So it's very important to work with community. We are working with community health workers to be sure that we explain those people to advocate for themselves. What do I mean equality, what happened with racism, the discrimination, what happened to them when they don't have access. So we need to definitely work on these issues, because we have been seen in Chicago, and I has been working and building Chicago 2.0 and now 2050, that there are communities who certain things, heart disease, hypertension, and obesity is endemic. So what is the big problem in the community? So you can, now we're going to coronavirus issues and what happened with the crisis that we confront, and we are not prepared, and we has not been prepared. Even we have certain issues related to preparedness in Illinois, how to work all together to be sure that people have the information they needed. And the coronavirus is in a situation who has been the displacement, the job, the inadequate job for our community, for people who are undocumented, who have no access, who are losing the job, isn't a big thing. So I wanted to leave there and this, and we can continue with the coronavirus things, Lisa.
No, well, it's a very relevant point, though, that you made. And so let's touch on that a little further, because I think a lot of people are going to be interested. I think the issues that exist now are only magnified more by COVID, and they're not going to go away after COVID. So of course there's a lot of work that needs to be done on the policy advocacy side. So continuing on that point that you made regarding the quality of foods and how it places individuals of color or individuals with chronic disease, which is more prevalent in our communities of color. What can we do to educate further and work with pantry providers and those who are distributing foods to ensure that there is the access to the right foods when individuals are coming to seek food assistance, to ensure that it's not going to put them at more risk in terms of their health needs, right? That it's not going to put a diabetic in a spike because they're getting a package of food that, while they are getting food that they need, but they're getting something that's packaged that has excessive amounts of carbohydrates.
Yeah, the whole issue is this, and I want to say that my recommendation is because I observe what is going on it's a lot of good intention for voluntary people working in the pantries. The issue is sometimes those people have no training, what kind of food, and no requirement to say what your doctor recommended. So one end, we wanted to see that doctor provide like a prescription, what kind of type of food they need according with the disease. And this is one thing. So the pantries can receive the type of food they can distribute, and who could be nutrition, healthy things. And in the other hands, if people in the pantry, they don't know those people who coming to get food, they don't request them to see what is your doctor or how we refer all those people to see a doctor. So my preoccupation is seeing people with obesity, with heart disease, with hypertension, giving food. They are totally against the health condition of those people. So seriously, we need to talk about and working in the community, so the providers or the social agency more in quality and teaching people what means nutrition according, and people are eager to learn. So this is one of the policy issue to change those things is because we try to give food, they are not good for and we continuously increasing heart disease, obesity, hypertension, and people dealing with medication more than change their behavior related to what they eat. The same thing with the children. I mean, we have obesity in children who will affect the longevity of living. And the issue of, if we're talking, and we can discuss this in coronavirus disease, a lot of patients with heart disease develop what they come in coronavirus, the cytokine protein and the stromocytokine with people who have problem in heart condition, they end up having more exacerbating symptoms in coronavirus. So the idea that healthy behavior and good food is medicine is a very key issue in our community. We need to deal with housing and jobs, and that's another issue. But related to food, we need to emphasize in these issues in mental health. So I invite everybody who is listening to follow the recommendation. The coalition, they cannot do everything alone, and this is one of the philosophical issues that we need to collaborate with each other. We need to put the idea that we need to work all together to change what happened in communities. So we can go back to certain community related to coronavirus, zip code 29, and in the area of Pilsen little village, who the situation is endemic. And you have a hospital like San Antonio, Mount Sinai, Access, the Federal Qualified Health Center, and the agencies in the community, they need to collaborate to support each other to be better. I don't want to expand it because in California, they can deal with the Chamber of Commerce to do better recommendation in the menu on the where people get food and dinners and restaurants in the community. So we need to be vigilant and involve consumer and the community to be sure that we have healthy communities.
And this is an issue that, because it touches everyone in some shape or form, not just those that are food insecure, it's a great opportunity to work collaboratively with our food providers, not just those that are providing food assistance through pantries, soup kitchens, et cetera, but also our restaurateurs, because they've also played a key role now, particularly during COVID, in providing food assistance. And it's such a, I think, an opportunity now that that door has opened even further to work collaboratively with them. Now, touching on that, because we do have limited time, do you have any thoughts in terms of where someone can go and volunteer if they want to be a part of a soup kitchen or donate their time to gathering food to distribute it? What do you recommend for those who just want to do something to be part of the solution?
I said to whoever want to work with in collaboration with the Chicago Hispanic Health Coalition, can send an email to us, can call us, and see, maybe you have good ideas, and we will see the question they have, how we can help people really to change behavior. Because if you say culturally, from people who are immigrating from another country, they really used to have good ideas, and they have today good ideas how to eat healthy, except that we have the economical issue influence the nutrition issues and the cheaper things as the word food, and people, because they don't have economical resources, buying cheaper food who are not good for them. So it's something they need to take more time, Lisa, to discuss how we working more in the future. I think we need to work in a long-term plan and be sure why over times, and the time that I have been working with has not been changing, what happened in community and how to help each other and different needs, okay, and nursing home and food in the school system. We can discuss, and I'm willing to listen good recommendation for the people who are participate to bring ideas and how we can say we showing a healthy, by 2050, a healthy community.
And we are most certainly stronger together. So
Yeah.
There might be people who maybe aren't able to volunteer at a soup kitchen or a food pantry or gathering or collecting food items, but maybe they want to be part of that policy advocacy piece. They have some work already invested in it or whatever the case may be. I know the coalition takes interns, so even students can contribute to being a part of this solution. And I wanted to speak a little bit more about how interns work with you to help advance your mission.
Yes, and I think it's a good exposure. People are continuing graduating from epidemiology for nursing, and the idea that in order to do research and for people who are involved in policy and research, the only place that you learn is in community. Listen what happened, what are the needs of people. So I will say the only way you learn is working in the community about what are the needs and how connecting people with it. Because the frustration sometimes the consumers have is they don't get support. And that's something that we need to deal with that. Plus, we can train in early voluntary. We have been training for diabetes program to training in any church and any workplace and any factory and in any school who wanted to voluntary and give the good information to educate the consumer. I think we need to go block to block. We need to talk to the politicians who work in the area with the school, but we need to create a strong communities. A small block zip code, community areas, but the power comes from the consumers.
Thank you. And we wanted to share with all of you, because we've been talking about different opportunities for people to volunteer, or if you know someone who's seeking resources for food assistance, we wanted to share a few key resources. Of course, we've mentioned the Chicago Hispanic Health Coalition and the work that Esther's been leading, and as our featured conversation today. But also the Illinois Department of Health and Human Services, if someone needs to apply for food assistance support or SNAP, they can visit the State Department of Health and Human Services website or call 1-800-843-6154. The Chicago Public Schools, as some of you may know, has been providing support, given that children who are now at home and not being, particularly those who are dependent on the breakfast and lunch programs. The CPS has been providing families and children meals from Monday through Friday between 9 a.m. and 1 p.m. through the CPS Grab and Go meal program. And you have the link there for the site locator so that you can identify the site nearest you or someone that may be in need of food assistance. Also, the Greater Chicago Food Depository has been organizing, as well as the Northern Illinois Food Bank, organizing food assistance programs, food distribution, making sure that those are safely aligned by providing setups outside so that individuals don't have to come indoors when possible. And you can use the links there to even identify a food pantry locator. And also Salud America is offering various different resources and key facts, not just on food access, food equity, but also about COVID-19 and different facts that you may be interested in knowing, and in collaboration with CDC and many others.
Yeah, I think if you are interested to be a trace tracker on coronavirus, we can give the information because the state is training ones. The other thing is counting, working to we don't put everybody there, but the Illinois Hispanic Nurses Association that are diligent working in the community. We need to work with the nursing homes. So I'm open this question and preguntas, but I think the issue is how we can collaborate it with each other the best of we can offer to be sure that we don't continue an endemic destruction of the poor community in Chicago and all over the country. So thank you so much, Lisa, for inviting me to discuss this, and I have my heart to work with anyone willing to really help people. They are there in the community and they are open to listen to us. Thank you.
Thank you, Esther. Thank you for your time and for sharing your wealth of knowledge with us today. I feel like you're an icon in our community, and you have contributed so much to our community, and you do it selflessly with an open heart. So it has been really an honor to have you and have you share your incredible insights. I had been following the chat throughout, and I didn't see any questions posted, but I did see a few thank yous extended here for you. So, and we're actually right, on time. We did want to quickly share that we have a few upcoming sessions. We have Dr. Moctezuma Garcia on June 4th, who is going to be discussing health inequities in the Hispanic community. We also have a group of amazing frontline nurses, Ms. Susana Gonzalez, Dr. Elizabeth Aquino, and Ms. Edith Bosque, who are all trained nurses doing amazing work through the National Association of Hispanic Nurses. They're going to share their perspectives and experiences, and they're going to be joining us on June 5th. On June 11th, understanding that many people during COVID have been experiencing sleep issues, we're going to have a sleep expert, Dr. William Marty Martin, join us and give us some tips so that we can have more restful sleep. And,
yeah.
With that, we want to thank you again for joining us today. We want to remind you, here's our contact information if you need to contact us. You can reach Tanoma Consulting at info@tanomaconsulting.com or Esther Sciammarella at chhc@chicagohispanichealthcoalition.org. But please remember to be kind and loving to one another. You never know what someone else is experiencing within their context, their lived experience, and their reality. There are food assistance programs, but some people may have trouble accessing these. So please check on your neighbors and see how you can lend a hand, maybe by picking up food for them and bringing it to them, especially our elders who may not be in a position to leave their home. So check on your neighbors, be a part of the solution, volunteer. There's so many different ways you can volunteer. Stay connected with others, and please follow the guidelines so that you can stay safe. Gracias. Thank you everyone for joining us today. Peace and love.